Hi, I'm Dr. David Hill, and today we're going to be talking about cures for a coughing baby. Now, the first thing to say here is that there are lots and lots of reasons that babies cough. Some of them are quite harmless, and some of them are life-threatening. So the first question is, if your baby's coughing, do they have something really bad? Well, I would ask, first of all, is there a sign of respiratory distress? Is your baby breathing more than 40 times a minute? Do you see the skin pulling at the base of the throat, underneath the rib cage, or between the ribs? Is your baby using his abdomen to get air out of the lungs with every breath, or making a little grunting noise, a little with every breath? Do you see the nose flaring? Those are all signs of respiratory distress, and your baby needs to be evaluated by a doctor urgently. It could be pneumonia, it could be RSV, it could be asthma, but whatever's going on, somebody needs to see what it is and what needs to be done to fix it. Now, another thing babies can get is a sinus infection or pneumonia. Usually, sinus infections occur in children who've had a cold for a little while, and if the cold symptoms are not getting better after about 10 to 14 days, we start to think there may be a bacterial infection. Now, let me back up right here. We never assume that an infant with a fever necessarily just has a cold, especially if that infant is under 3 months of age. If your infant is 3 months of age or less and has a bad cough or a fever, you need that child seen immediately by a medical professional to figure out what's going on. But say you've got an older infant, 6, 9, 10 months old, who's got some cold symptoms and a cough. You want to know what to do. Well, you can use a humidifier in the room. You can use Karo syrup or another commercially prepared corn syrup to try and ease the symptoms. If, however, you hear wheezing, see respiratory distress, or note that your baby has a high fever, definitely you want to take that baby to a doctor to see if he or she needs breathing treatment, steroids, antibiotics, or hospitalization. Talking about how we cure coughs in infants, I'm Dr. David Hill.